Good morning, everyone, and welcome to the Labor Law Series. My name is Matt Piesel, and I'm a labor and workforce specialist located out of Kansas City, Missouri. Today's webinar, our Labor Law Series rather, is with Vince Palermo, and he will be discussing different ways to address substance misuse. I also want to let everyone know that this presentation will be recorded and shared on the Labor and Workforce page. So if anyone misses this, just direct them toward the Labor and Workforce page, and we'll be sharing that link with you in the chat in case you're unfamiliar with the page. As we go through the presentation, you're more than welcome to unmute your microphone and ask Vince directly, or leave a question in the chat feature, and I will direct it towards Vince as appropriate. Again, it's been great having Vince this morning, and we'd like to turn over him to introduce himself and the solutions that his company offers. Vince?
Thanks, Matt. I appreciate it. I wanted also to thank Doug and Amy for the opportunity here. So I'm just very grateful. So my name is Vince Palermo. I'm in business development. My company name is SoberGrid. I'm excited to participate in the Labor Law Series today to discuss the effects of drug and alcohol addiction or substance use disorder, and talk about the potential solutions to reduce relapse rates. So before I get started, I wanted to review an agenda that I had set for today. So I'm going to just provide an overview of who we are. I'd like to review a financial assessment example as I review this with businesses that sets an expectation, understanding what the total cost of substance use disorder is within their organization. At any point, if anyone has any interest, we could kind of talk offline or just to discuss your particular union or labor group. I'm also going to review our solutions, the SoberGrid solutions, and it is a combination of a SoberGrid app. It's our social media recovery network, peer recovery coaching, and 24/7, 365 crisis support. All three components can be managed within an app. And I'm actually going to go through an actual demonstration so you can actually see what the actual app looks like and how it performs. And then lastly, I'm going to talk about the value proposition. We talk about a return on investment. So in particular, we're going to be talking about cost avoidance, and I'll share what that looks like in the financial assessment example, and then some of the benefits of our partnership. I did have Q&A at the end, but like Matt had said, you can, if you like, just feel free to stop and ask any questions as we proceed forward. So SoberGrid was founded in 2015. We have two co-founders, Bo Mann and Nick Krasuki. They are both with the company. Bo is the CEO and Nick is the chief financial officer. They are both in recovery themselves. And they saw a significant gap in the continuation of care and barriers to access help, and sought to remove those barriers and enable individuals to have access 24/7, 365 live support. We first developed what's called the SoberGrid app, which is our social media recovery network. We then introduced peer recovery coaching and crisis support. All, again, can be accessed within the SoberGrid app. Our mission is to help communities, and in particular, we're working with unions to fight the effects of substance use disorder by extending the much needed care. We are committed to innovation and recipients to multiple grants as we continue to develop research tools to lead the industry. I'll share with you some of those findings through the National Institute of Health, our phase 1 trial. And today, SoberGrid is the largest mobile community in the world We have over 300,000 members. I'm going to review a sample of a financial assessment that I have done. Again, if there's something in particular that I can work individually with your group, I'd be more than happy to do so. When I am working with individuals, it's important to understand the financial obligations that, that a group may be encountering. This is a third-party site that I use. It's from the National Safety Council, and it calculates the real cost of substance use based upon their members. So in this particular case, this example, I'm sharing an ideal group that say has 5,000 members, that is located, in the state of Missouri, and it states the amount of cost to that organization. So in this case, it's about, it's over, 6.9 million annually. And that cost is broken down into 3 areas: lost time, job turnover and retraining, in healthcare. So that's the first initial aspect that I look at. The second one is what people or who is affected. So based upon this scenario of 5,000 members within the construction industry located in Missouri, as you can see that it's, impacting total members and dependents, over 1,200 members. And then lastly, it would be, if there was an application that were to be applied, what's the potential cost savings? Or in this case, what's the cost avoidance that we look at? So potentially, in utilizing a solution that we have, there's a potential cost avoidance anywhere between 20 to 40%. So these would be some of the initial goals that we would set up or look at for an organization before presenting, any type of actionable plan. Excuse me. This is the impact of substance use disorder to an organization. I just want to make sure the slides are caught up. So understanding that there's a human financial toll of addiction, it's very significant. What I wanted to highlight are the key drivers of the problem. Number one, 90% of people needing addiction treatment don't receive it. And 2, for those that do receive treatment, 40 to 90% will relapse within the first year of post-treatment. That's where we feel a solution, providing a solution like SoberGrid, can be very significant to reduce those percentages and reduce the chance of relapse. This chart is from ASAM. ASAM is a professional medical society. It's in the field of addiction medicine. This illustrates the continuum of care and the structure a patient may encounter from early intervention to medical treatment. As I stated on the previous slide, those that do receive treatment, 40 to 90% will relapse within the first year of post-treatment. I will share how the SoberGrid solution can be implemented at any point in the journey and complement and enhance any current programs. So typically what I experience within unions and labor organizations that they may already have in place would be employee assistance programs or in and outpatient programs. So we do complement each of those programs. Our program is very intensive, and we have the ability to collaborate with each of those programs. So as an example, if someone is in a treatment center, our coaches have the ability to communicate with the treatment center. And if there's information that they would share back and forth with a particular member, everything would be confidential. Everything is HIPAA compliant. In addition, understanding that the journey is, it is a long journey, and the journey is, people are different parts within the journey. Utilizing a service like SoberGrid is a potential for a great referral source to any type of in or outpatient opportunities. One of the greatest challenges unions and labor organizations face is stigma. This is a chart from the International Foundation of Employee Benefits. It illustrates how employees feel about addressing their challenges with their employer and the impact it may have on them. So the top three are: workers fear admitting a problem may negatively impact job security. 2, workers fear about confidentiality. And then workers do not acknowledge or are not ready to address the problems. So going in, we understand already that there's definitely going to be challenges. So the amount of awareness and education that is necessary is just imperative. As I was explaining to Amy earlier, having a service on a website, it's good to have that, but it's not going to be effective. There needs to be a continuation of education and a continuation of awareness that is developed and shared with the members and their families. With COVID, I think everyone understands with COVID, there's been a significant increase of isolation. With that, there's been a significant increase of overdoses nationally. With a solution like a SoberGrid, members can still stay engaged and receive the necessary assistance without traveling to, say, a brick or mortar that we've seen to be extremely beneficial. Now that we've reviewed the financial assessment for just that sample union or labor organization and the challenges to manage substance use disorder, I wanted to present our digital solution and how we can assist in reducing relapse rates. The first is the SoberGrid app. The SoberGrid app is an iOS Android compatible. It's used in over 170 countries with over 300,000 members in a rapidly growing social recovery community. It has very high rates of retention and engagement. What I mean is once someone downloads the app and utilizes the app, they really stick with it. The app is a personalized, easy-to-access resource for tracking and sharing the progress with others, giving and receiving support, and accessing 24/7, 365 live support. The best-in-class experience has evidence-based features such as peer coaching, motivational enhancement, and daily check-ins. And we are actually working on predictive analytics that will identify relapse risks. I will share with you in a few slides what some of those unpublished studies look like. Our mission in delivering peer support is to drive the benefits, including improved in and outpatient outcomes, the reduction in ER visits, hospital readmissions, and decreases in insurance costs. The SoberGrid app is a positive community that has shown to be effective at reducing relapse rates, isolation, and negative impacts on individuals. The daily engagement begins by tracking your progress with a check-in, daily quest, and daily inspiration. The sober counter is a daily reminder and reinforcement of their sobriety. The Sober Grid app also allows users to find other people nearby on the grid. It's a GPS locator user interface that displays user profiles and distances from them. What's also important to remember that confidentiality and anonymity is very important. Users can choose to remain anonymous. There is a get support, give support. It offers support from the community when they need it most. In addition, the burning desire button offers users the ability to reach out to community either when they need it most, or they can reach out to a coach 24/7, 365. The sober community thrives on having a safe and supportive environment, and members have access 24/7, 365 for support anytime, anywhere. This is a follow-up to the previous slide on our innovation. This is a finding from the National Institute Phase 1 project. So we've developed these predictive analytics algorithm to predict those at risk for relapse based upon comments, chats, and posts within the app. The algorithm used to examine what's called natural language processing from the post, comments, and check-ins for active Sober Grid members. We are currently in a phase 2 of the project study to redefine and understand what the potential relapse risks look like. So looking at this chart, this scale that we're looking at, the words to the left have a high propensity for relapse. The words on the right have a lower propensity for relapse. In addition, these clutter of words, these are the words that have a very high propensity for relapse based upon someone's indication that they've have relapsed after using these types of word groupings. And then conversely, these are positive words that people have utilized that have more or less likely of relapse. The logic here is once we've developed this potential algorithm is to potentially reach out to individuals that we believe are in the midst of a relapse. With a successful recovery, the word that you'll hear quite often is engagement. Engagement is imperative. The Sober Grid app has over 12,000 messages sent within the app per day, and the average active user uses the app over 37 times a month. The benchmarks are very high. 41% of our active members use daily quests, and that's where they take action to complete the daily recovery focus exercises. And then in 2020, Sober Grid was used over 20 million times. The second part of our solution is what's called peer recovery services, or peer recovery support services. This involves the process of giving and receiving non-clinical assistance to long-term recovery from substance use disorders. The benefits of peer recovery coaching include sharing the lived experience of recovery combined with training and supervision to assist others in initiating and maintaining recovery. Peer recovery support services can support any type of clinical treatment for substance use disorder. We have a diverse group of peer recovery coaches, and we allow the clients to select from a range of males and females of their choosing. Our peer recovery coaches are in long-term recovery. They support many pathways to recovery, and they teach individuals how to accomplish specific tasks and provide support, and they praise their achievement. To some of our clients, our peer recovery coaches are their main support system just due to lack of support from friends and family. By providing around-the-clock access, along with our Sober Grid app, many clients are able to receive the much-needed continuum of care. Our peer recovery coaches share the lived experience, creating relatability and building trust, which is a huge difference. They act as liaisons for clients and help them access a variety of services and provide support and accountability. Our peer recovery coaching consists of several 15 to 30-minute scheduled coaching calls. Their coach will assist them in actually developing an action plan. I'll share with you what one looks like. And they hold them accountable to working the plan. They will advocate for and empower the clients to voice their needs and concerns to case managers and providers, and will monitor their clients' goals over the longer range, from the pre-recovery stage throughout active recovery and long after formal treatment services have concluded. As the clients move forward in recovery, coaches remain accessible by phone and have access to our crisis prevention 24/7, 365, and other peer coaches anywhere, anytime they need it. Peer recovery coaching is a critical service and is strongly recommended with any type of existing medical service or treatment, and it leads to the maintenance of sobriety. There's two studies that I wanted to reference here. One is through Case Western Reserve University. They conducted a study that demonstrated better outcomes when peer coaching is used. In addition, the Substance Abuse and Mental Health Services Administration, or SAMHSA, conducted two rigorous systematic reviews on the effectiveness of peer-delivered recovery, and both concluded that there's a positive impact. Our peer recovery coaching services eliminates the barriers to access support, along with 24/7, 365 availability for immediate response. The program also assists with resources and recovery plans in addition to other peer recovery coaching support. And then lastly, effective substance use disorder solutions need to be available and accessible when needed. Our crisis support services are available for individuals to have access to a certified coach via the Sober Grid app 24/7, 365. I'm now going to actually give you a demonstration of the app. So everything that I've reviewed through the slides, you'll actually see on the actual app. So if you just give me a moment here. Okay, so this is the app that you're looking for. This is the Sober Grid app. I would encourage each of you to download the app. You'll see how friendly and easy the engagement is. As I stated earlier, the daily quest, where 41% of our active members utilize, these are the focus exercises that are done. So there are 4 daily quests that take place. The first one is reading daily inspiration, which is a positive passage for the members to read. The second is the check-in. And there's 4 questions that we ask in the check-in. Did they relapse? What is their mood? What's going on? and have they sought professional help? In regards to the algorithm on the predictive analytics, what's going on is where we're using the natural language processing to make that determination. In addition, we're also incorporating the mood. So those are the features that are being utilized for the predictive analytics. The third engagement is writing a gratitude list. Anyone that is in sobriety understands that being thankful for what they have for this day and any day is very important. And then the last is commenting on a post. So each of these is to encourage engagement within the app and keep them focused. That's the daily quests that take place. The triggered feature that is up above, if someone at any point, at any time, feels the need to either use through a drink or smoke or inhaling or taking something, they can hit the triggered feature. There are two actionable steps that would take place here. One, they could actually post their concern to the community. The interesting part is when individuals actually post it to the community, the amount of immediate and positive support that one uses, it's tremendous. It's so encouraging to see. And then the next one is that they can actually message or call a coach and speak with a coach directly. In addition, I mentioned about the grid. So again, you would see the same thing that I would see if you download the app. If I go to the icon down below and I just select it, these are individuals that are in my proximity that are on the app today. And again, individuals don't have to include an image. They don't have to include their real name. It could be completely confidential. Sometimes the question that I ask is, would I know exactly where they are? No. The benefit behind this is that if individuals are traveling and they are thinking that they're the only ones out there, they would have the ability to see other individuals that are on the app that are nearby them on the grid. They could actually message them if they would like. Selecting a coach is very simple. They go to recovery coaching. In making that selection, they would have from a range of coaches to select from. They have the ability to select the coach's background, read about the coach, and make their selection. They could rotate coaches, understanding that, hey, maybe this coach is not for me, but they have the ability to select any coach that they want. The icons up above, again, they could schedule a session with them. The icon in the middle is they can actually text their coach or they could call their coach. So that provides you an overview of what the app looks like. And then this is just, what the feed is. This is the feed within the app. I stated before, there's, over 12,000 messages that are sent within the app a day. So here's someone that actually, checked in. And this is, that's what the feed looks like. Again, I would encourage you to take a look at the app at any point. Okay, I'm going to go back to the presentation. So from a value perspective, or some, we would refer to a return on investment. Just want to make sure that the slides are caught up. So while offering a best-in-class solution, we think our return on investment is significant. The SoberGrid solution, could reduce relapse rates up to 40%, as I stated earlier, to reduce healthcare costs associated with relapse. That equates from fewer emergency room admissions, overdose events, reductions in the number of clinical appointments and interventions, and far less likely to require expensive readmissions and detox in inpatient rehab centers. Other cost reductions include fewer long-term chronic and expensive healthcare problems and risk reduction in patients with comorbidities such as diabetes. The asterisk down below states the ability on our phase 2 to refine the observation and relapse risk, which we're hoping, once the studies do come out, we'll have the ability to publish that type of information. In regards to our partnership and the benefits, we feel that the partnership begins or starts with the engagement of our SoberGrid global community, which improves outcomes. Our exceptional certified peer recovery coaching program is essential while offering the most advanced technology in the industry. In addition, the solution removes barriers to accessing critical support by delivering 24/7, 365 live support with a proven reduction in relapse rates and a strong and immediate return on investment. So that concludes just the overview of the presentation and the demonstration. If there's, I know I have some questions probably in the queue. If you wanted to open those up, I'd be more than happy to answer those questions.
Sure, Vince, this is Doug, and there's a few questions in the queue, but also I think there may be some more online. If people want to unmute their mics and ask the questions directly, that's fine. I'll start with a question for you.
Sure.
Are you able to determine what time of day people are using the app most frequently? Is it when they first get up? Are they using it more frequently during their normal work schedule day? Is it after the end of the day, after the kids are put to bed? Is there any kind of a pattern as to when we're seeing people in need of the app more likely?
Sure. That's a great question, Doug. So typically where we see the volume is in the morning and in the evening. That's probably the greatest volume is when someone gets up, if they're working, if they're going into work, we'll typically see a spike then, and then after their work day.
Interesting. One of the questions in the queue is asking about is the app working available to work with all kinds of addiction, chemical as well as behavioral addiction?
It is. Yes.
And also, could you speak to the aspect that part of the app is free and part of it is for a fee for service? Yep. Can you explain how that breaks down?
Yeah, definitely. So the app is actually free. So anyone can download the app for free and participate in the posting and everything that I shared with you, except the peer recovery coaching and crisis support. Those two components, there's a fee associated with that. If we're working with unions or labor groups, the pricing structures, typically we work on something a per member per month. But yes, the app is free. So individuals do have the ability to, again, download the app and utilize that at their will.
Yeah, your product, your service, you personally were referred to us from a labor union, which we're always grateful for those kind of connections on great new topics for the labor law series. But you just mentioned how it breaks down for a labor union. Is that similar for employers? We've got a question in the chat box for how the pricing would work for employers. It would be along the same lines per employee per month.
It would be, yes.
Do we have other questions, or people would like to unmute the mic and ask other questions? While we're waiting to see if there's any other questions, you talk about the peer recovery coaches. This is an area that I'm starting to become more aware of myself, and I know that they're in high demand. What's the seniority or longevity of your coaches? How often or how long have your coaches been with you? Does it take them very long to become proficient with your delivery model? Do they like this model do they prefer this model over the the traditional meeting with people direct face to face? Can you talk a little bit more about how the recovery coaches are working?
Yeah. No, I'll tell you. So I've spoken, to all of our coaches, and they are probably the most uplifting, grateful individuals that I've ever encountered. They are just beyond grateful for the opportunity, and the only thing that they want to do is help others. So in order to qualify, the qualifications are they need to be in long-term recovery for a minimum of 2 years. All of our coaches exceed 5. In addition to that, there are multiple courses that they take in order to kind of maintain their certification as a coach. The protocols that we're utilizing on the certification are from 2 areas. One is we're utilizing a lot of the principles that SAMHSA has developed. In addition, the state qualifications, they range throughout the entire country. We have adopted Ohio's peer recovery qualifications, which we feel is very high quality. And so each of them have that type of certification. What I can do, Doug, is I can actually, send out what the formal qualification looks like, the amount of hours that which they take place and what they're actually doing. One of the aspects, if I can maybe make sure that I can share this, is the recovery plan, which is, let me see if this is going to come up here. The recovery plan that we've developed. Let me see here. See if this comes up. Oh, here we go. Okay. So this is an actual recovery plan or a sample of a recovery plan that our coaches will review with individuals as they go through the process. It's self-guided, so there isn't a particular tool or time frame that an individual would need to achieve within a certain certain aspect. And it's been very, very effective with individuals to develop a plan and have them kind of work through the plan. But this gives you an idea of what this may look like. It's pretty lengthy. It's about 17 pages. That what it reviews with individuals as they go through the plan.
Very helpful. Thank you.
Yeah. And then, I'm sorry, go ahead.